I was part of a plastics themed core surgical job. So I had about 16 months of plastic surgery to look forward to in the 2 years of core training. And at that point, I realized that the microsurgery course will be very useful for my training going forward to just assess if I had the aptitude for it. Did I like it? I was committing to an entire life of plastic surgery. But actually, was I good at it? Was it something I want to do for the rest of my career? So I heard very good things about the Ganga Microsurgery Course. It's also another excuse to go all the way to India, which is fantastic. I heard that it was 3-1, so 3 students and 1 trainer, which seemed like a very good trainer to trainee ratio. And I also heard that the operating there was phenomenal, so you could use it as an observership while you were doing a microsurgery course. So I went twice. There's a CT1 and an ST5.
What was the one thing that stood out to you going from CT1 doing the course to an ST5? What was the thing kind of in terms of how you
I think it's a good question. The good thing about Ganga course is you write reflections after every day.
Yeah.
So I didn't have to remember. I actually read all my reflections when I went back, and it was very different. As a CT1, you did an end-to-end, and my reflection was, it worked. It was so nice. It worked. And going as an ST5, you start critiquing the placement of your stitches. How evenly placed are they? How long it took you to do it? How long it stayed patent for? But it's a completely different benchmark you set for yourself. So we started off with some lectures, looking at our Backlund's lectures, understanding how to position yourself. And we started on chicken thigh. That was day 1. And then we moved on to live mice. So they were anesthetized for us, set up. We dissected out the femoral vessels, which are just under 1 millimeter in diameter. And we were practicing on that. So we did end-to-end artery, end-to-end vein, an interpositional vein graft, and an interside. And that was the end of it, was the interside. So if you could do the interside, you graduated the course. How was your course? What did you do?
I did the Northwick Park Course. I did it at the end of CT2. At this point, I hadn't got a number, but I got a job as a non-training plastics reg. So in the build-up, thinking I might get asked to assist in micro, I thought, okay, I'm going to have to do a course. I should do a course now. At the time, it was a week in London. It was a course my bosses had very much recommended. But he'd spent a good 5 days essentially dissecting out the femoral vessels like he did of rats and interside anastomosis end to ends, interposition grafts, and at the end, the sort of boss level was doing a tiny rat groin flap where he dissected out the vessels and try and anastomose them. But it was, at the time, having not done an awful lot of micro going into it was such nice exposure. And like I said, it was a very good experience.
Did you have any teaching outside of the microsurgery? Was it just you go for a course and you come back?
In that, it was essentially you go, you get the teaching, because you'd start off with a demonstration, it would be talked through the techniques, and then you attempt to do it yourself on these rats. That, I really enjoyed it.
Did you find it boosted your confidence, do you think?
Yes, actually, I think it did. Having said that, you come out of it thinking you can do all these things, and then you realize you're still a very junior reg, so you're not actually going to be doing quite a lot of these things for a little while. But it was at the time.
And did you find that there was a long period between when you finished your course and when you got to do your first anastomosis on a patient?
Yeah, yes.
I
haven't done my first anastomosis in a patient yet, so yeah, it's been fun. But I'm getting more comfortable with my group.
See, what I found as a CT1, like you mentioned, you asked Kanch when you do your first anastomosis. I actually found that the course as a CT1, you get comfortable using a microscope or a micro instrument. You're supposed to do all these tissue diagrams.
Yeah.
Well, for people that don't go on this course, they actually struggle through it, as you know, whereas having the background of this course, although you're not doing a vascular anastomosis, it makes the tissue low stress. You put in proper epineural stitches. You position yourself better, you're quicker, you're more efficient. And there are still things as a CT you can put in use from your micro course. Was your experience much different to what I've described?
No, very similar. I think I've gone there for just over a week. So I had the course of obviously flying out and organizing things like hotels and things. So that just took a little bit of organization. But I think the course overall was very similarly structured. So the first day of familiarizing yourself with the microscope and an actual setup. And we had, I think, live rats from the very first day. And I think very much towards the end of the week, you're really a lot more of a confident microsurgeon by the end of it. the shame of it is similar, and I think that a drawback for everyone is that we all get excited about doing the micro, and then it could be months and months. And I think microsurgery is one of those careers where you constantly need to be keeping your skills up and running. Otherwise, you can lose that skill or the finesse within that. I think within a short period without regularly applying it. I think
That was my main reason for going back as an ST5.
yeah.
Felt now that I was getting opportunities, I wanted to be as slick as I thought I was at the end of the
Yeah,
first course.
yeah.
And so it was lovely refreshing.
Under the supervision of Miss Missy, who is filming this, and if not on this side of the camera, we're going to be going through the various kind of building up the micro skills. So going through the basics first. Today we've covered positioning, setting up the microscope, handling of instruments, right up onto putting in stitches and then starting to work on anastomosis. And the hope is starting with baby steps, we build up confidence along the way over the next couple of weeks.